February is American Heart Health Month, a time to remind you to focus on the health of your heart and encourage your family, friends, and communities to get involved. Our sponsor, the Heart and Vascular Institute, has a team of heart specialists to help. We are joined by interventional cardiologists Dr. Mahir Elder, Dr. Tamam Mohammed, and Dr. Amir Kaki to learn more. Thank you all for being with us.
Thank you for having us.
It's our pleasure to have you. So let's start with heart disease. What is it and why should we be concerned?
Well, Tati, heart disease is still the leading cause of death in the United States. And according to the CDC and prevention in the United States, 1 out of every 4 deaths in the United States result from heart disease. So Tati, that's about 600 people who die each year from this condition. And heart disease does not discriminate. It's the leading cause of death in several populations: white, Black, Hispanic patients. Almost half of all Americans are at risk of having heart disease, and the numbers keep rising. While heart disease can be very deadly, it's also very preventable in most people by adopting a healthy lifestyle and early and potentially living longer due to a healthy heart.
Well, 1 in 4 is indeed significant. So how do you suggest that people cope with heart health in this COVID world?
Well, it's well known now that patients with COVID disease, they will have a heart problem. COVID disrupts the immune system in the body. It also increases the coagulation or the clotting activity. And studies found that people who had heart disease had 5 times more risk of dying after conducting COVID-19. This is why it's very important for patients who had heart disease to be screened and to be treated if they have COVID-19. We also know that patients who had COVID-19 and they recover very well, they could have symptoms of heart disease days and months after they conducted the virus, and they could really have a heart problem even after full recovery from COVID-19.
Wow. Yeah, we do hear about that connection, Dr. Mohammed. So now what should people know about coronary disease?
Yeah, I think so. What people should know about coronary disease, particularly in the midst of this pandemic, is that coronary disease, as Dr. Elder alluded to, is a very lethal disease, but preventable if diagnosed and treated. And right now, we notice across the country there's a spike in cardiovascular deaths because patients are hesitant to come to the hospitals. And we're here to tell you that if you have symptoms of heart disease, to include chest pain or shortness of breath, you really should see your physician. And if it's an acute setting, if it's onset, you should still go to the hospital. Not going to the hospital for fear of COVID is a mistake, and it unfortunately has led to a major spike in people dying at home for lack of care, which is really shameful because a lot of these people could be treated and still alive today. So I encourage everyone, despite the fact that we're in a pandemic, the hospitals are safe places where we could provide cardiovascular care and potentially save you and your loved ones' lives.
Thank you for that information. It definitely is a concern. And thank you all for joining us today.
Thank you.
Thank you for having us.
Our pleasure. Well, we will continue this conversation on our Live in the D Facebook page after the show. We will discuss important heart health issues such as symptoms of a heart attack, which is really important to know. So please join us for this Live in the D Extra on our Live in the D Facebook page right after the show. And to learn more about how the Heart team at the Heart and Vascular Institute can help you or a loved one, visit their website, heartteam.com. Again, that's heartteam.com.